How to start your Monday morning. Start the fire, boil the water, grind the coffee, add filter, coffee in the filter, water into filter, watch it drip, more water, watch it drip some more, fill your cup, raise your cup, and no. Leave the house and leave it up to the professionals to make the coffee. I'll stick to the conversations. Welcome to Caffeinated Conversations with Brooke Allen. Hey, welcome to this special edition of CCWBA. We are focusing on Men's Health Month, all in an effort to raise awareness. That means health issues and encourage men to actually take care of themselves and maybe figure out where they leave their wallet too in the meantime. So actually, I was doing some research last night in heart disease, and you guys, I have Dr. Casselman with me and Jeff Selik with me. And I don't know if you will agree with me on this, but they're saying heart disease is still the number one leading cause of death in men. Yes?
Yes, very much so.
Okay, so that, and then cancer is the second,
Mm-hmm.
and then suicide is the third.
Sadly, yes.
Okay, and then diabetes, fourth coming in, and then the last one was accidents and unintentional injuries.
Yeah, I mean, a lot of this can be divided up in age groups. So certainly our younger males, we're going to suffer more deaths due to that last one.
Okay.
And as you move into later decades, fifth, sixth, seventh decades, you're going to see more of the cardiovascular disease and certainly cancer coming into play.
So when we're talking cancer, are we talking a certain kind, or I mean, is it pancreatic, is it colon, or what?
So long colon, right? But specific to males, we worry about prostate cancer, of course, and we should be screening for that. So that's,
I think it's so interesting how, and it happens with women too, right? The whole mammogram thing, like what age should you get a mammogram? Oh, you don't need that anymore. And then I think the same thing has happened with some screenings for men, right? To where it changes as opposed to if do you have a history of cancer, or how does that stand right now as far as?
Well, I think specific to prostate cancer, you really need to take a global view. So you need to look at the patient's personal history, but also their family history. If they have a father and uncle who had prostate cancer, we really want to get them some earlier screening. We also need to be aware of things like, if we're using exogenous testosterone therapy, it's important to follow that PSA marker throughout the therapy to really, stay ahead of it.
So to keep an eye on it.
Very much
and
so.
Can you explain what a PSA marker is?
So a PSA is an enzyme that leaks out of the prostate, and everyone has a physiological level, but certainly in the cases of cancer, that level will be elevated. So it's not exclusive to cancer. There is some other things that can cause it to leak and elevate, but it's important that we're following that.
And I know some people get tests, right? So it's all by numbers, but they end up on the high normal, if that's a thing. And then you have to go back and get tested again. And then your anxiety goes up because you're worried that something's going to show up or be more prevalent the next time, right?
That's absolutely true. Yeah.
I should have been a doctor.
No, you're making really good points. So, with PSA specifically, there is some anxiety closely related to it. So we want to have a good conversation with the patient. Let them know that, hey, a small elevation doesn't necessarily mean you have cancer. It may need that we need to take additional steps to investigate, but also serial testing is of value. The trajectory of someone's prostate is very important. And there are normal, non-pathological prostates that fall into a higher range.
Okay. And as you get older, does that number go up?
It typically does trend up. And things like benign prostatic hypertrophy, which is common to most males, that's just growth of the prostate,
okay,
can cause it to rise, which again is not a cancer issue. So that's why it's so important to talk about these things and really spend time with the patient to explain it to them, because you're right, it can be really scary when you see that number and you say, oh, it's out of range. Right?
And especially if you're checking it through a portal or something. Right. I think that is so detrimental, actually, to be able to get your results through a portal. And so you're just reading it and you're not a doctor, so you don't know. And then all of a sudden you're flipping out because it's a high normal or it's one number above or something. And I don't know. I just think it's a huge anxiety for women too. Right.
Yeah. So that's why at GameDay, we do a blood test with instant results. You get that PSA score within minutes.
Really?
We think and agree that early detection is the key. And this is why we give every man that comes in a free PSA test. And we think that beyond early detection being the key, we track each one of our patients' PSA with multiple tests throughout the year. We think that it's important to trend every man's PSA to be able to continue tracking. Just like the doctor said, an elevated PSA doesn't necessarily mean that it's prostate cancer, but it's good to be able to track it. So if someone's PSA does rise, it's not a bad idea to suggest that they go see a specialist. And we have had patients of ours that have had elevated PSAs that we have referred to specialists, and unfortunately, there has been cancer involved. So if it wasn't for us to maybe find it and refer them to somebody, they maybe wouldn't have known about it. So it is important to more than ever for men to be able to get those PSA tests, be able to make sure that they're staying on top of their PSA scores.
So you said you do it at GameDay, and we'll talk about what GameDay is in a minute, but you said that you do it for every man. Does it depend on their age, or you just do it in general?
Again, unfortunately, prostate cancer is on the rise for younger and younger men, and early detection is the key. So yes, as men get older, there is a tendency for that PSA to sometimes get higher, but we treat men that are in their 20s, 30s, 40s, 50s. We even have an 80-year-old patient, or a patient in his 80s.
Okay.
But it is important to trend it during the course of the year. We do multiple tests just to see how that PSA is, if it does change during the course of the year.
Okay, so GameDay is very interesting because this is a franchise.
Correct.
And when I was on your website last night, I saw a bunch of footballs and like basketballs. And I'm like, do they play, are you actually playing games? But it's all geared toward men.
Yeah, correct. So typically men don't like to go to the doctor, Brooke. It's no secret. It's the first appointment that they want to cancel, the last one that they want to go to. So GameDay was created to give men an opportunity to come into a clinic that doesn't look like a typical doctor's office, to be able to have a stigma-free environment, to be able to help them with 4 core areas, whether it's testosterone replacement therapy, long-term erectile dysfunction treatment, weight loss services, and injectable vitamin therapy and peptides, all in an environment that is a Detroit sports-themed environment to help them relax and be like, hey, wait a minute, this doesn't look like a doctor's office. It feels more like a sports lounge, and I'm a little bit more at ease.
Right.
We tell guys there's no shame in your game. We'll treat you like a brother. And it really does put guys at ease to be able to open up. I own the clinic. My wife is our medical provider, and they feel a little bit more like, okay, this isn't a typical doctor's office. I can relax a little bit and ask for help. There's nothing wrong with asking for help.
So how long have you been open?
So this past May 15th was our 1-year anniversary.
And you're located?
And we are at Square Lake and Woodward in Bloomfield Hills, right off of I-75.
Okay, so so I'm gonna put you on the spot a little bit, because you're a doctor and you have a practice.
Yep.
So what do you think of this approach?
I mean, I think low testosterone across the board is pretty undertreated, and there's a need for attention to that. And, I'm a primary care doctor by trade, and we don't always have time or the will, or we don't always have the comfortable level of treating testosterone unless you've done kind of additional training in that. And so there's a lot of men out there that aren't getting the care that they need. So, I mean, I think it's really cool. I think, like we talked about at the start, our mission is very similar, really to take care of men, and in my case, women too, but really the people that are falling through the cracks and maybe not getting the attention that they need.
So why do you think that is? I mean, Jeff, you have a franchise that's geared toward men only.
Yes.
So why do you think men are so hesitant to get help?
So first thing is, again, I think that there's a stigma. Men are, taught often in our society from a young age that it's maybe not manly to ask for help, that they're just going to go to work, do their job, come home, and they're just going to suck it up, be a man and don't ask for help. And that's not right. They're internalizing all of these, the suffering. They're not sleeping well. They're feeling low energy. Their mood is off. Maybe their wives or their partners are telling them, you're moody. You're not, treating the family right. You're not treating me as your partner correctly. You're not spending time with the kids, and maybe they're having some erectile dysfunction. Maybe their libido is off. These are all symptoms of low testosterone, and they don't know it. There's a learning curve there that they don't realize that by just optimizing, and that's the key word, we're not looking to get guys jacked, turn them into Arnold Schwarzenegger.
Okay.
We're just looking to give them a better quality of life. And once they realize that they can get help, it's this light bulb goes off. It's like, whoa, I can feel better.
Mm-hmm.
And that's what we're looking to do, is just give them a better quality of life. And once they realize that, and that's why at GameDay we give a free testosterone test, doesn't cost anything, 45 minutes of your time. We have a lab right in our clinic. It's come in, testosterone results within 15 minutes, instant results. It's no more wait a
No
week.
portal.
No portal. Get your results quickly.
Mhm.
Sit down with my wife, our amazing clinician, to get
Mhm.
your free consultation. And again, if TRT is medically approved for them, something that can give them a better quality of life, get you started in that very same appointment.
So I can't even say it. Say it for me.
Testosterone.
Yeah, that. Okay, so you mentioned a bunch of different things like anxiety and
Yeah.
depression, moodiness. Does that
Yes.
all play a part in?
Most definitely. I mean, 23% of our patients are veterans. I mean, that's huge. I have guys that come in that say, Jeff, you saved my life.
Mhm.
Like, you don't get it. You literally saved my life. I was suicidal and I didn't realize how much better my life could be. I mean, imagine how meaningful that is when someone tells you that you saved their life. And they are really telling me that it's unfortunate that sometimes the VA doesn't give them the care that they feel. They push them off when it comes to testosterone therapy. And, I'm so glad that this doctor is really on top of understanding the need for TRT, testosterone
Mhm.
replacement therapy, because a lot of doctors just say, oh, you're within range and you're normal. And at his clinic, his office, he understands that it's not about being within range. It's about being optimized, that you can feel better. And a lot of guys are just like, I don't want to be within range. I want to feel better.
Right.
And, there is an opportunity to be able to have that better quality of life.
Do either of you ever have women call you and say, "Hey, can my husband come in?" Or
All the time.
Really?
We
Yeah,
talk
very
about
much
this
so.
as well at GameDay, that, men are often the ones that are responsible to take care of the family, but the women's take care of their husbands. They're the keeper of the men's hearts, right?
Mhm.
And we get women all the time that say, I'm booking for my husband or I'm booking
Do
for
they
my
show up?
boyfriend. Yes. If they don't, they're in a lot of trouble. And, if they're a good husband,
Mhm.
happy wife, happy life. That's
Right,
what we
for
say,
sure.
right? And most definitely, I mean, I love to interview the wives and say, tell me how your husband's doing and tell me how he feels after. And they tell me how much more balanced they are, how much happier they are, how they spend more time with the family. I'm living proof as well. I mean, I have 3 kids at 51 that are under the age of 6. And
Oh.
I know how much more energy that I have for my family
Right.
at night. And our guys live the same lives. I mean, it's something that, again, can really give you a much better quality of life.
And so it's so interesting because it's kind of like, okay, are we just talking sex here? But it's more than that.
Very much so. Low libido is certainly a sign of low testosterone. And it's one that we take very seriously because it's like tightly linked to quality of life. But you mentioned fatigue, sleeplessness, anxiety, decreased recovery after exercise. These can all be kind of more subtle symptoms that, again, don't come up in conversation, or a man might not think of them as typical symptoms. So they kind of just brush it off. Oh, I'm getting older. It's no big deal. And so that's why it's important to test and treat appropriately.
And if I might add, the difference between doing testosterone safely and recklessly
Mhm.
is the regular labs, getting your blood monitored. Guys that get it from a buddy at the gym or
That
out the
sounds
back door,
sketchy.
it is, but they don't realize that as long as you're getting your blood monitored, and that's why if you do it through a doctor or medical supervision, you're getting your blood looked at a couple times a year to make sure that your
Oh, so
testosterone
it
levels.
isn't like every week or
No,
something.
no.
Okay.
But every, we do it first after the first 6 weeks to make sure that your levels look good. And if we change your dosage, we'll do it again in 6 weeks. But if we leave it alone every 3 months to make sure that your testosterone levels look good, your estrogen levels are within range, that your red blood cell count is good, your PSA we're looking at,
Mhm.
you just want to make sure that your levels are being checked regularly to make sure that everything is safe and that everything looks right. It's when guys aren't looking at those things that they start to feel off and they're not being monitored. That's when it's not safe.
Do either of you, we've talked about anxiety and depression and the suicide rate among men.
Do either of you refer therapists, or do you have those resources?
Great question.
Absolutely. I've again worked in primary care, and it's so critical to take care of mental health. It's one of the kind of key components to your general health. So we have therapists that we work with all the time in the area. And sometimes, we're combining medical therapy along with that therapy, that behavioral therapy, but also you can't neglect sort of lifestyle. Those are kind of the three critical components that we're always working, toward with anxiety, depression, really any mental health challenges are.
So the twist with you is that you have a gym, don't you?
Yeah. So
You have a gym in your office.
yeah. So our practice is sort of multidisciplinary. I do the medical side, but we have trainer nutritionists on staff, and we have an in-house gym. So it really sets us apart as far as what we can offer. It's not uncommon you go to your primary care doctor, or really any doctor, and they say, hey, make sure you're eating right, do some exercise. But really not
What does that
diving.
mean?
Yeah, exactly. What does that mean? What does that mean for the individual, right?
Mhm.
What kind of exercise should I be doing? How should I be managing my diet? So really that was what prompted the vision for this. Was I wasn't able to deliver that in traditional primary care. In this setting, I can connect them on site, go through a strength and mobility assessment, see where they need help, what their strong suits are, and really design a plan specific to them.
And you were a football player, right?
Yeah, in college, yeah.
Okay.
Yep.
So you were a football player, so you kind of get that whole vibe of, listen, we need to figure this out and do the whole thing.
I think that's where my interest started,
Mhm.
right? Of course, I ended up in medical school and sort of found that there was this huge gap, right? We were not connecting with people on the level of how to execute exactly what you just mentioned, which is like the exercise, the strength component. These are huge potentials for lifespan and health span that
And quality, I
and
would
quality
imagine,
of life.
right?
Yeah, and throwing medicine at it is not enough. We really need to be doing those foundational things.
So
I want to
have you
touch on that
Yeah,
mental
no,
health
yeah, go ahead,
component as
please.
well, because that is so very important. So at GameDay, we have a referral corner because there are so many great opportunities for us to really help promote health and wellness beyond the services that we offer,
Mhm.
with great partners that can also refer us when it's outside of the scope of services that they offer. For example, we do offer long-term erectile dysfunction treatments. And sometimes it is hormonal, which
Mhm.
we can help with. Sometimes it's vascular, which we can help with. But sometimes it is psychological,
Hmm.
which does fall outside of the areas. And that is where a mental health specialist will come in. And again, my wife will give the consultation, and she can, again, assess maybe it is something that's not medically within our capabilities to help. And that's when we would go to our referral corner and pull out one of these mental health specialists and refer them and say, you know what, maybe you should talk to this mental health specialist, and they can help you a little bit better than we can.
So can you both of you address kind of the embarrassment that goes along with that? And I mean, because at the beginning we talked about how it's men need to be strong and take care of the family.
I don't think there's really any embarrassment. The thing that I think has really helped I don't even just want to say success, but the um, culture at our clinic is because we are a concierge type of clinic. When you come into our clinic, it's a very much a one-on-one environment. I don't stack our waiting room full of people.
Oh, okay.
So when the gentleman comes in and sits down, it's him and I, and we really start to talk, and they really talk to me. First of all, I book them myself, so
Oh,
we
you
have
do?
oh
Okay.
my god, yes.
Okay.
So we really have a heart to heart first about what's bringing him in, and I get to learn a little about, and if it is erectile dysfunction, we talk a little bit about how long he's been experiencing it, what has he tried. So I get a little bit of information on the phone. Are they married? And
Hmm.
then when they come in, we talk a little bit more. So I really do learn a little bit about them, and again, we get this connection where they trust me, and we really start to talk a little bit about how we can help them. And again, I'm very clear, we don't just throw pills at guys, which are
Hmm.
just short-term band-aid fixes. We want to get to the root. People ask me sometime what I do for a living, and I save marriages.
Hmm.
I mean, intimacy is very important when it comes to helping people overcome ED. That is very important to give that back to people. I mean, I used to sell furniture and that, as important it was to help people with that, I'm really doing, we're really doing important work now for people. So if I can give that back to people in their marriage, that's really meaningful work, right? So I want to help get to the root with my wife's expertise in the medical field to be able to help give that back to people. So they need to trust us. So if I can get to the root and then my wife can come in and do her part, we can really help. So they open up, they tell me things and they tell her things because, unless you trust your medical provider, you're not going to get anywhere. So there really is an embarrassment. We really get their trust because how else are you going to help them?
Well, and that kind of goes back to what you said and why you kind of went into this arena, right? Because you, as a primary care, didn't have the time or the energy, maybe sometimes.
Yeah. I think everyone's aware of kind of the limitations placed on modern medicine, and it's unfortunate. Now, that doesn't mean that you can't establish a long continuing relationship, and many primary care doctors do that very well, even in those small amounts of time. But I agree, spending more time getting to know the patient, knowing about what's going on in their life.
The whole picture,
The
right?
whole picture. That's exactly right.
Yes.
And understanding how some of the medical things tie into their daily life, how it's affecting them. That gives you such great perspective on what the appropriate treatment is, moving forward.
So how so you've been open a year, and then you have an open house on Saturday, right?
Yeah. We have a men's health expo.
Right. Okay. So that's going on Saturday. And what is the one when your phones first ring? What is the biggest question you guys are asked?
That we are asked?
Yeah. When somebody's calling you,
Yes.
What are they looking for, I guess?
Sure. So depending upon what service they're looking for, they want to know, how can we help them feel better? I would say out of all of our services, testosterone replacement therapy is probably the most inquired about. And the question that I ask them is, what inspired you to call us? I think that's a good, word because it's really something that's meaningful. And then, I like to dig a little bit deeper to find out, what are they looking for? How can I, maybe big picture, how can I change your life for the better?
Right.
And I want to just really find out, are they just calling for that free testosterone test and just curious to see,
And
what
do
the
they think you're
numbers
going to
are?
just dole out,
Right. Because we do obviously a lot of, Facebook and Instagram and Google advertising. And, you throw out something for free. You do get some people that just want to take advantage of the free offer. Or is this someone that's genuinely interested in a better quality of life? And then with a few questions, you can find out if this is somebody that really needs some help. And, so the people that say, they'll start telling you, I don't give them, are you feeling this, that, or the other?
Okay.
You let them tell you, I'm low energy, I'm not sleeping well,
So you don't lead them.
you don't lead them. Very good. Right. You let them tell you kind of what they've been feeling. And again, a thing that to me maybe does separate me from a lot of other places, because my clinic phone rings direct to my cell phone. I get calls all times of night.
That's not annoying.
I am dedicated to the service that I do. And when my phone rings at 11 o'clock at night, and it's a different ring, or dare I say 1 o'clock in the morning, I say to my wife, it's probably an erectile dysfunction call.
Really?
Yeah. Because who else is going to be calling me at 1 o'clock in the morning? Okay. Most likely they just had an erectile dysfunction episode and they went downstairs, they started Googling, and they found me. And I'm going to pick up that phone and I'm going to set up an appointment and I'm going to help them.
Right.
Right?
Yeah, for
because
sure.
that's what we do. Okay. Because that's when they were in need. And that's what I'm here for. They don't expect that you're going to pick up the phone at 1 o'clock in the morning.
For sure. They're probably thinking they're going to get a voicemail.
That's right. And I get people that call me on Sunday and say, oh, I didn't expect someone to pick up. But it takes 2 minutes of my time to pick up the phone and show them. And this is
your business.
And I tell people we're more family business meets medicine. That's the whole approach, is I want to flip medical on its side and show people that it can be a more warm family business type of experience. And that's frankly, what we've done over the past year is just give people we have over 400 patients, and to know everybody by first name when they walk in the door, it's a very different type of experience. That's what we want to give.
And you are the first location in Michigan.
Very first, yes. And
Any
the
plans
largest.
to open another one?
Yes, I did buy a couple territories.
Oh.
But at this point, I am very ambitious to grow this one, which is, in my opinion, a very great location where we are, as large as it can before I spread myself over to another location. I joke that, everybody I want to get the Jeff and Esther experience. My wife is Esther.
Okay.
And before I move to a second location, that means that I have to replace myself at the first one.
For sure.
And I don't want to shortchange the people at the first location yet. So I haven't made that decision as of yet.
Okay. Well, thanks for sharing that.
Yeah, thanks.
I feel like I got the scoop. Okay. So, doctor, what about you? You have this expo on Saturday.
Yeah.
Okay. So what can people expect?
So again, it's at Mission Metabolic Health, our practice, and we're going to have a few different offerings there. We actually have in-house massages being done, like quick ones. We're going to have a couple exercise sessions.
Should men wear workout clothes?
Yeah, best to wear comfortable casual clothes.
Yeah.
You'll have an opportunity to tour the facility, see our offerings. My wife's a dentist. She'll be there kind of with some goodie bags.
Look at you two. You're so awesome.
We're going to have healthy snacks available.
Right.
And then we actually have the trainer talking about fitness and really how to hone in specific for men and recovery. And I'll be talking about some medical aspects of important things to cover for men's kind of long-term health. Really, how should they be viewing their long-term health? Through what lens? What should they be asking their doctors about? And of course, highlighting how we can help.
Has life expectancy for men, has that dropped? I thought I had read that has kind of gone down, right? Or is
I'm not sure. Yeah, I'm not sure off the top of my head.
Okay.
Over
We're
what
doing
time
what we can
period?
to raise it.
Yeah, yeah,
I'm
that's right.
I'm like, ask Dr. Google. But it is interesting because it seems like men, no matter if they're married or single, there's always these health issues, and unless somebody's bugging them, they're not gonna take care of it themselves.
Most definitely.
Okay, so
Yeah.
question for you: who makes your doctor appointments?
So my wife still does make my doctor's appointments for me. Yep. Most
Okay,
definitely.
so
just
I credit
talked
you
to her
for
about
admitting
today.
that.
Oh
Okay,
yeah.
all right.
Oh yeah. She
Okay.
controls the schedule.
It's a little bit easier for me. Like I see one of my old partners in the practice, so it's
Okay.
like I just pop over there. I text him. It's
You're like, hey
yeah,
man, I need an appointment.
Yeah,
Yep.
they send me the auto reminders. Just like
They're
everyone
like,
goes through.
really? That's so
Yeah,
funny. So
yep.
so your patients have your cell phone.
They have my office phone, which forwards to my cell phone.
Okay. And then
Correct.
do you send out text messages
We
too
do.
and all the,
Yep.
okay.
Yep.
Are you on Instagram?
Yes, we are at Mission Metabolic Health. Yep.
Okay. What's your Instagram?
At GameDay_Bloomfield.
What's your Insta, man? So, okay. So if you had one thing to say to a man who's experiencing any issues that either of you could help with, what would be that one thing you'd say, Jeff?
I'd say there's no shame in your game. Come to Game Day. We'll treat you like a brother. It all starts with that free and easy 45-minute consultation, free testosterone test. And let's start from there.
How about you, doctor?
I would say this is like a very big opportunity in your life to really take ownership of your health and drive it in the right direction. You really have an ability to live longer and better. And it's not, even if it's a minor inconvenience coming into the clinic, you really gain great perspective if you have the right doctor navigating you through the process.
So do you, as a doctor, do you try to, how long have you been doing this? 10 years or?
So yeah, I've been in primary care for 10 years.
Okay.
This new practice has been open for about 6 months.
Okay.
Yep.
So for the 10 years when you first started and where you are now, how has your view on medicine, has it changed at all?
Very much so. Being in primary care, you're tasked with a lot. When you're starting out, it's sort of like deer in headlights, learning how to manage patients from not just a hormonal perspective, but from every issue that could walk in, right? So delivering the standard of care was kind of the focus. But, doing some advanced training, I have a fellowship in obesity medicine, learning more about metabolics, and how that can benefit and prevent long-term disease. I'm really have moved to a place where I want to take it beyond the standard of care. Getting your colonoscopy, your PSA, those are all important things. We can do more. There's greater technologies out there. If we're leveraging lifestyle, especially diet and exercise and sleep, we can do so much more for the patient than is being offered as that standard.
I see you shaking your head. What are you thinking?
No, I definitely agree. There's a lot more opportunities for men to take care of themselves than they're currently doing. I hear it all the time. I get patients coming in that are 60 years old and they're telling me 60 is the new 40, Jeff. A patient today that just turned 60 that was wakeboarding this week. And I feel really good that we're able to give guys, I don't know if that standard of or that lifetime expectancy has gone up, has gone down, but I'm seeing our guys having a much better quality of life and really living life to the fullest at 60. I hope I'm wakeboarding at 60 years old, right? I can tell you that at 51 years old, I'm in the best shape of my life right now. I have more energy than I've ever had, and I'm seeing our guys really, every guy that walks in the door, the first question I ask him is, how are you feeling? How are you doing? And if they tell me anything other than I feel good or I feel great, I'm digging deeper. I know it's a thing that in life we ask people when we see how you doing, and then we just brush it off, right?
Yeah.
That's not what I mean. When I ask a guy, how are you doing? If he tells me anything other than good or great, I'm digging deeper. I really mean it. I want to make sure every guy that walks the door says he's feeling good or feeling great.
And I imagine you feel the same.
Yeah, I think it's, medicine is a unique opportunity to really gain a perspective into people's lives. And it's special in that way. We get to find out intimate details or get to know their family, get to know what events are important to them. So I view it as a huge opportunity and really an honor and take it very seriously. So.
How do people make appointments with you?
So very easy. They can do it a couple different ways. They can either call me directly at 248-433-3900, or they can just go online to GameDayMen'sHealth.com/Bloomfield Hills and set up an appointment right through our website.
Okay. And then for you, do people have to register for Saturday?
Yeah, it's best to call, or you can email us at info@Mission Metabolic Health. And we'll sign you up and get you on the list.
What time does that start?
It's going to go from 9 to 11 on the 28th.
Okay.
Yep.
And I know you treat women too. I mean,
Yep.
right? So can women come to that, or is
Absolutely.
Okay.
Women are invited. Again, we just talked about how important they are to men's health.
Yeah, right?
Yeah. So we would love to have them see our facilities, see what we have to offer.
That is awesome. So Jeff, what is your demographic?
So it's really funny because we really figured that we would be, when we opened, that it was going to really just be men kind of in their 40s and 50s. But as we really saw, and as I'm sure that you'll agree, testosterone levels have dipped for men, really to the point that we do have men that are in their 20s. It's not as common, but we don't stereotype and we don't, discriminate, I should say, against men in their 20s. We let our testosterone blood sample analyzer tell us if a man's testosterone is low in his 20s and he's symptomatic, we'll start him on TRT. So we do have some men in their 20s, all the way up to, as I said, we have a gentleman in his 80s. So I really do focus in our territory area within Birmingham, Bloomfield, and the surrounding Metro Detroit area. So again, as long as people are above 21 years old, that's really where we kind of start. We don't go below the age of 21. As long as they don't have any contraindications such as cancer. And if they had cancer, they really would need medical clearance from their oncologist or from their doctor. And they're symptomatic. We don't just automatically start somebody. They really would have to be symptomatic and, fall below a threshold with their testosterone test. We're happy to be able to get them started.
Do you take insurance?
So great question. We do not take insurance, and we made the deliberate choice, Brooke, not to take insurance because my wife came from a family practice that was an insurance-based provider, and she had to see like 6 to 8 patients an hour, as most family practices are, which gave her like 5 to 10 minutes per patient. We want to spend 30 to 45 minutes with each patient, get to know them, get to know their medical history, develop an individualized treatment protocol. Can't do that in 5 to 10 minutes. So that's one reason. Two, we know many of our treatments aren't going to be covered by insurance, whether it is testosterone, ED treatments, weight loss, or peptides. So we just took insurance off the table, but we do accept health savings accounts and flexible spending accounts for people that have that as methods of payment.
Okay, awesome.
Very similarly, for our menopausal hormone therapy, testosterone therapy, our weight loss programs, as well as our executive physicals. Right now, we're not accepting insurance, but we are adding capabilities on that front. We're likely to start a concierge-based primary care in the fall, where we will be taking insurance.
Okay, perfect. Thanks, guys. Thank you so much for joining me. And I know you weren't planning on meeting today, but surprise.
Yeah, it's been great. Yeah.
No, we're both coming from the same perspective, and it's an honor to be able to, like I said, be able to see eye to eye on how we can both help men across this great state of ours.
Well, and as I'm not married, I'm divorced, but as somebody who, you always want the best for all the men in your life, right? You want them to take care of themselves. You want them to be around. You want them to have fun and to, be healthy and enjoy life as much as you can. Right. And so, you're both doing that. So I hope more men call and make their own appointments.
Thank you.
Jeff.
Thank you. Thank you.
He's like, thanks for calling me out on that.
Thank you. Thank you.
And since you can just text, I guess, or walk over or whatever, you're off the hook for now. But, thank you so much. I appreciate it.
Thank you.
Thanks for having me.
Website one more time.
Yeah. GameDayMen'sHealth.com/Bloomfield Hills.
Website.
Mission Metabolic Health.com.
Okay, guys. Thanks so much. And happy Men's Month.
Yeah.
Men's Health Month,
Men's
right?
Health. Yeah.
Thanks.
Very good. Thank you.